Okay, like I said, this is a practical section, objective structure clinical examination in surgery. This is in preparation for your examination coming up next month. And then again, I said this class will be purely interactive. Please don't be fearful to make attempts that are not correct. It's better you make all your flaws here and it's corrected, so that by the time you get to your exam, you'll do very well. So what is your diagnosis? I need answers, please. I need answers, please.
Cleft palate and lips.
Okay, now this is how you go about it. If you say cleft lip, you pass, but you don't get it. You get like maybe 1/3, 1/3 of the mark. The answer is left unilateral complete cleft lip. Now, let's use this opportunity to discuss cleft lip a little bit for better understanding. Now, cleft lip is there's a failure of fusion in cleft between the embryo. During development, they first develop about 5 processes. One they call frontonasal process. They develop a maxillary process, a mandibular process. So they develop 2 mandibular process, which from the lower jaw, 2 maxillary process, which from the upper jaw, and then a frontonasal process, which would also divide into 2 again eventually from the nose trim. Now, when the 2 maxillary processes fuse, the upper lip is formed. So there's a failure of fusion of the maxillary processes. That's when you have clefts. Having said that, to classify clefts, you can classify cleft into complete or incomplete. How do you know the cleft is incomplete or is complete? If the cleft extends into the nasal seal is this bridge here in your nose, this place here. This is the nasal seal. If it extends beyond this into the nostril, then it's called a complete cleft. If you look at this cleft extends into the nostril. It has breached this place. You can see my cursor, right? Can you all see my cursor?
Yes.
Yes.
Okay, so once it breaches this place, then it's a complete cleft. So you can see that the cleft has extended beyond this. This is a complete cleft. Now, like I said in surgery, you must put the side. It's as simple as that, left or right, a good mark. This is the left face. So this is the left side of the face. So this is a complete cleft, complete left unilateral cleft lip. Now it can also occur in both sides. When it occurs in both sides, it comes bilateral, right? But this one is unilateral, so it will be complete left unilateral cleft lip. That's the diagnosis. So what's the complication? If anyone can hazard a guess.
Difficulty feeding.
Okay. Now let me help you.
Difficulty speech.
Sorry.
Difficult speech.
Speech, right? Okay. Now let me help you. Now for cleft, the next Osce will do, I'll show you cleft palate. For cleft lip, right? They don't have problem with those things you are talking about. They only have problem with cosmesis. That's the only problem they have. It is cleft palate, which I will show you in the next Osce. Not this one today. The next I will do Osce, I'm going to ensure I get the cleft palate picture for you. They have this problem of speech, recurrent ear infection, malnutrition, lower respiratory tract infection, It is cleft palate that has those problems. But for cleft lip, the problem they have is usually cosmesis because it's not fine. And secondly, sometimes the other problem is when they go into adulthood, they may start having psychological problems such as depression, and sometimes they may suffer from infanticide from their parents. But the major problem that they have is cosmesis. That's the problem that the patient has. Other problems are secondary to the pathology, which could include depression later in future, infanticide from the parents who may feel uncomfortable and then subsequently kill the child. Again, those are secondary problems, but it's a particular problem you must mention is cosmesis. They are people with poor cosmesis. Again, this cleft palate that has those problems with phonation, otitis media or ear infection, recurrent ear infection, recurrent chest infection, malnutrition, and co. But for this one again, like I said, it's purely cosmesis. So what is the rule of 3 in management of this condition? Can someone answer the guest?
I think correctional surgery and maybe I don't know, maybe antibiotics.
Okay.
Because of the gap. Well, I don't know. I think correctional surgery.
Okay. Okay. First of all,
but this is my guess.
Yes,
Yeah.
I encourage when you talk. That's nice. Keep it up. But this rule of 3 is a common question when cleft lip occurs. And if they bring cleft lip for you in MCQ, you may see it there. If they bring it in orals, if you guys in your Osce session is oral, they may bring it there. The rule of 3 is just a guide in the management of cleft lip, and it states as thus rather, that for you to operate a patient with cleft lip, the patient should be at least 10 weeks of age. That's number 1. The patient hemoglobin must be at least 10 grams per DL. And the patient weight should be at least 4 pounds. That 4 pounds is about 4.5 kg or 4.6 kg. So that is the rule of 3. Please note that rule of 3. Patient should be at least 10 weeks of age, at least 10 weeks of age. Patient should have had a weight of at least 10 pounds, and patient should have an hemoglobin concentration of at least 10 grams per DL.
Oh, okay. 10 pounds of weight, right?
Yeah.
10 pounds of weight.
What is this? List 2 syndromic association that one may see with this condition. Now I'll help you. All the trisomy that you know, trisomy 13, trisomy 18, trisomy 21, they can all come down with this. Others are Van der Waals syndrome, which you may not need that one, but just with the trisomy 21, 18, and 13 are associated with this one. So what's the treatment for this? The treatment for this is called chelioplasty. Chelioplasty. Or if you can't remember, just a cleft lip repair. So is there any question anyone want to ask before we move to the next question, the next slide? Is there any question?